oxygen dissociation curve, percent of saturation, pressure of oxygen for the hemoglobin is sigmoidal because it resembles the S letter is known as a sigmoidal. And we say that this is a heme-to-heme interaction. The net effect that the affinity of the hemoglobin for the last oxygen bind is 300 times greater than the first oxygen. What does it mean? For example, after releasing all of your oxygen, okay, I want to explain the last line. The net effect is affinity of the hemoglobin for the last oxygen bond is 300 greater than. What does it mean? Okay, I release all of my oxygen in a tissue, okay, and now I became a T form, okay, and the T form turned back to the lung, okay. Heme-to-heme interaction means that, please pay attention, the binding of the first oxygen is very difficult. So difficult. You know, the opening of the structure is very difficult. But after binding of first oxygen, it induces some conformational change. You can bind easier. Easier, very easier. So the last one, 300 times easier can bind to the oxygen. Do you understand? Because heme-to-heme interaction. It sends a signal, it's easy. Send a signal, easy. Send a signal, easiest. Okay? So this interaction for the binding of oxygen, known as a heme-to-heme interaction. When we have a hyperbolic, in the enzyme section, I will describe about the allostric molecule, but a little I want, inshallah, on Tuesday I will discuss about the allostric molecule by details. But about the proteins, you should know that, generally, just know that, when we have an allostric molecule, allostric originates from Greek word, other space, okay? Yani, hemoglobin has the other space that some molecule rather than, I don't know, oxygen can bind to control the function of this molecule. At first, as I mentioned, the oxygen can bind to the hemoglobin. The H, yani pH is important. These are allostric effector, yani some molecule and some circumstances that can affect the activity of the hemoglobin. Yani, this list of items can increase the affinity, can decrease the affinity. Okay? They can change the affinity of the hemoglobin. Whenever one molecule can affect the affinity, they act as an effector. One of them is oxygen, another one is pH, another one is carbon dioxide. Another one is 2 and 3 by phosphoglycerate. What does it mean? As I mentioned, the presence of molecule affect the structure. Affect the structure, yani affect the affinity. For example, in a lung, what is the effector molecule? What is the predominant molecule? Oxygen in a lung. So when oxygen is present, yani it increases affinity. But for example, in a tissue, the pH and also carbon dioxide are present. But what is the effect of pH and carbon dioxide? Maybe I ask this type of question. Please tell me, proton or acidic pH and carbon dioxide increase or decrease the affinity of oxygen? At first you should think that, what happened in the tissue? Acid is present and CO2 present. What was the form of hemoglobin in tissue? Closed form, T form. T form has a low affinity or high affinity? Low affinity. So yani, proton or acidic pH or CO2 can cause a decreased affinity. Do you understand? These are some effectors. And this is a actual change of the dimers of the hemoglobin. This is just for more information. We talk about the heme-to-heme interaction. We talk about what happened in a peripheral tissue, what happened in the lung, and about the Bohr effect. When we are talking about, maybe I ask you in your final exam, effect of pH and carbon dioxide, pH yani proton. When we are talking and explaining the effect of the pH and carbon dioxide to the affinity of the hemoglobin, yani we are talking about the Bohr effect. Okay? So what is the sample question? For example, Bohr effect. Explain the effect of the temperature on a binding of oxygen. False. Effect of the glucose on the affinity of the hemoglobin. False. Just concentration of hydrogen or pH and pressure of the CO2. And this is the explanation of the Bohr effect for your level. There is no need. And I want to a little talk about this molecule. You know, in some situation, in a hypoxia, what does it mean, hypoxia? Low pressure of oxygen. In a high altitude, like going mountain. In an anemia, what is anemia? Are you familiar with anemia?
There are types of anemia, but basically the red blood cell doesn't have the ability to effectively carry oxygen.
Excellent. We have a different type. As a result, they cannot, actually these RBCs and hemoglobin cannot carry the oxygen. In all of this situation, our body produces one molecule known as a 2 and 3 phosphoglycerate in all of this situation. For example, you go to the mountain, you are at risk of low pressure of oxygen. Our body produces this molecule, 2 and 3 biphosphoglycerate. And you should know that this molecule stabilizes the T4. What is the actually affinity now? When you produce this molecule, the affinity increase or decrease? Decrease. Because it's stabilizes T4. I want to explain the reason just for this reason. Why we say that it's better to understand, I think it's necessary. This is not important for a final exam, just understanding. I mentioned that in a tissue here, we have a proton, am I right? We have a carbon dioxide. We have a 2 and 3 bisphosphoglycerate. At first, I want to explain that. This is a charged molecule. Whenever carbon dioxide wants to bond to the hemoglobin, it's entered to the carbonyl. It has a negative charge, positive charge. And by phospho, I know that phosphate is full of negative charge. As you can see here, what is the common between all of these situations? Charge. Excellent. The key point is charge. As I mentioned, what is the type of this interaction? Between positive and negative. So whenever in a tissue you have a proton, yani H مثبت, positive. مثبت first. In Arabic say مثبت.
Yes.
H positive. Carbon dioxide CO2 negative. 2 and 3 biphosphoglycerate 2 negative. It facilitates the charge of the formation of the between positive and negative. It facilitates the bond between units. It facilitates the formation of the, for example, interaction between the dimers. Yani, it facilitates for closure of the structure, okay, for closing the structure to form a T4 instead of R4. Okay? So in all of this situation, because you enter the charge, you facilitate the positive, negative. They bond together. Okay? Is it clear why we say that? This is the reason why we say that proton H plus form a T4. Because positive charge here because I have some negative charge here. They can interact with each other. So this is the reason of the stabilizing. We talk about this point, and this is the extra point. About the carbon monoxide, it is very toxic, as you know. Just know that carbon monoxide stabilizes R form. Okay? So in an exposure to this toxic gas, your structure would be from this one. If you be on exposure to carbon monoxide, CO, please pay attention. CO2, which form? T4. CO, R form. Whenever you are at a risk of toxic gas, I mean CO2, you are stingy. You cannot release the oxygen. So you are near to the, you cannot take any breath. Okay? And, this is that slide I take out. At least one of your questions will be from this slide. Please eat this slide completely. Digest with all of your enzyme. Okay? Because at least, Wallah, one of your questions will be from this slide. Because it is very, very important.
Maybe 2 or 3 or just
4. No, at least 1. So, what is important? I want to review because you are familiar. What happened in a tissue, as I mentioned, in a tissue, low pH. Am I right?
Yes.
Proton. 2 and 3 diphosphorylated, carbon dioxide. Also, after activity, you have a hot muscle. So temperature also close the structure. So high temperature, so they increase the P50. Am I right?
Yes.
They shift the curve toward the right. Okay? So in all of this situation, maybe I ask you about in which of situation you have an increased P50, or you have a deoxyhemoglobin, or you have a T4, or low affinity for the oxygen. In contrast, as I explained, carbon monoxide, high pH, low this molecule, low pressure of the carbon dioxide, and in a cold situation, you have a ينتقل المنحنى إلى اليسار يسار which form? R. Okay? In Farsi we say in rast. Rast means right. Okay? We say T. Rast. What when I'm in Sute? Yasar. R. Okay? Any situation that shift to the left stabilize the R form. Do you understand? Yes? This curve is very, very important. And this is a comparison between hemoglobin and myoglobin. As I mentioned, the comparison is not for your final exam. And now just 2 slides, I think. Because if I want to talk about the different type of hemoglobin, at least I require 2 sessions. But normally, I kill myself, I explain RT. I'm talking about the major type of hemoglobin. What is the major? Hemoglobin A. Okay? So if I ask you about the name of the major type of the hemoglobin, what is the subunit? Alpha 2, beta 2. Alpha 2, A2 actually, inshallah, one of your practical session is measurement, the concentration of hemoglobin 2. It is very important, especially in a thalassemia, okay? It's a combination of alpha 2, delta 2. The unit is important for you, okay? And hemoglobin F, alpha 2, gamma 2, inshallah, as a physician, you should be familiar with the different type of the hemoglobin. Embryonic, actually hemoglobin, zeta 2, epsilon 2, and in an abnormal situation, in a disorder, you have a sickle cell anemia, alpha 2, S2. And about the hemoglobinopathies, we have a different type. sickle cell we talk about, methemoglobin we talk about, instead of ferrous. Whenever you have a ferric, in this situation, at the middle of the heme, you have a Fe2+. If it's oxidized in a form of the ferric form,
Methemoglobin.
methemoglobin. Yes, this is an abnormal form of the hemoglobin. And about the thalassemia, have you ever heard this name? How many types are present? Have you ever heard this name? Alpha thalassemia and beta thalassemia. What do you think about this disorder? What's happening in alpha and what's happening in beta? In alpha thalassemia, as the name implies, alpha is mayu. In beta thalassemia, beta is mayu. Okay? And also you have a major and minor. Okay? What do you think about the minor and major?
We just imported the minor.
No. How many alpha is present in the structure of the hemoglobin?
Major is fatal and minor is
Yes.
doesn't kill you, but it's
Yes, it's a mild form of the thalassemia. What about the reason? In major, both of the alpha mayu, okay? In minor, فقط one mayu. And also in beta thalassemia. In beta thalassemia, in a major form, 2 beta is mayu. In a minor, 1 beta is mayu. Actually, this is a classification. This is 2 last slide. What is important? At first, you should know that beta thalassemia, as I mentioned, decrease synthesize of the beta, and after occurrence of beta thalassemia, you have the accumulation of hemoglobin F, hemoglobin A2, alpha chain, because beta is not present, alpha accumulates. And as I mentioned, you have a minor and major. So what is important? Maybe I ask you, no matter this is a minor or major, maybe I ask you, in a beta thalassemia, which type of hemoglobin accumulates? Hemoglobin F, alpha 2 gamma 2, hemoglobin A2. And in alpha thalassemia, because you have a deficiency of the alpha synthesis, you have the accumulation of hemoglobin BART. Alpha is not present, so you have the accumulation of 4 gamma and hemoglobin H, and because alpha is not present, beta produce and beta precipitate. This is the actually important about this slide. Many thanks for your attention.